Kalia. I'm going to be doing my checkoff for peripheral IV start. I'm going to start by entering the patient's room. Hello, my name is Kalia. I'm one of the nurse's students. I'll be starting your IV today due to the doctor's orders. They wanted to start an IV just to make it easier for you to get medications. Do you mind telling me your full name and date of birth? And then I would also check the wristband to see those identifiers. And then next thing I'm going to do is, before I even touch them, start the IV, I'm going to hand sanitize or wash my hands. And then think about what supplies I need to go grab. You'll need an IV kit that will look like this. You'll need a flush. You'll need Tegaderm, gloves, and then tape. All right. Are you okay with starting the IV today? Is it all right with you? It's gonna be a quick poke, but I promise it'll be over quickly. And just kind of reassuring, because this isn't very fun for patients to get poked all the time. So just being understanding, comforting to them. So I'm gonna go ahead and open up my IV pack here. I'm going to go ahead and set up the supplies. So I'm going to go ahead and attach my syringe to my tubing here. So let me just go ahead and open this. And then I'll go ahead and scrub the hub on this one here. Right here. I'll scrub it. Scrub it really good. Okay, perfect. I'll throw this away. Okay, I'll let that dry, and then once it's dry, I'll go ahead and connect my syringe to the hub, and then I'll go ahead and prime it. Make sure there's no air bubbles. Okay, perfect. And then I'm going to put it back into the sterile packaging in that IV kit, being careful with that end where the IV will touch. All right. Next thing I'm going to do is look for a spot for that IV on my mannequin here, or the patient. So I'll take the chlorhexidine, I'll break it by doing that, but we won't do that on the real dummy. And so I see a good area of the IV. It's nice, it's straight, it doesn't have valves. It looks really good. I can feel the balance and everything. So I'm gonna go ahead and scrub that area in circular motion for 30 seconds. Okay, perfect, did it for 30 seconds. I'll throw this away, and then I'll go ahead and attach the tourniquet up here. Being careful not to, put it on the joint, and then also another thing to think about 3 to 4 inches above the site that you're gonna poke them with. And then also, once you've cleaned that area, don't touch it again with your gloves, right? Trying to maintain that sterility. Okay, so I got my IV kit here, got my IV needle. And we'll get ready to go. Okay, Mr. Patient, we're gonna go ahead and get this IV started, okay? You're gonna feel a quick poke. So let me just go ahead and open up the needle cap safely. Don't poke it in your face or something. Okay, and then I'm gonna look for that area that I scrubbed. Bevel up, and then I'm gonna go in at around 30 to 15 degrees. So I'm gonna hold up here, pull the skin taut. I'm gonna go ahead and make the first puncture here.
No, because you clean the area.
Okay. So I'm just kind of adjusting.
So you'll do this
until I see the flash. So I see a good flash. So I'm going to advance a couple more centimeters up, making sure it's fully in there, right? Then I'll go ahead and release that tourniquet once I see that flash. Now I'm going to go ahead and take take out that needle, so then the catheter is just left. And I'll go ahead, and before just about I take that off,
you'll reapply it.
I'm gonna go ahead and get this guy out.
Again, and then immediately when you see the flash.
And then I'll go ahead and attach it.
You could wait this
But it will
up,
ooze, and that's okay.
do
That's
a
normal.
order.
Okay.
Just get all
So
your
now,
supplies set up.
before I even tape it down, we're gonna go ahead and flush to test for patency of that IV. So we'll flush about 3 to 5 mils of saline, and that's flushing really good. It's flushing very smoothly. We're not seeing any bulging around the site that would indicate infiltration, anything like that. So it's a good IV. It's got good patency. So then I'll go ahead and clamp the IV, the tubing here. I'll clamp it.
Okay. Gotcha.
Boop. Okay, it's clamped. I can go ahead and take off that syringe. Okay. And then I'm sure this is extra, but I would go ahead and scrub that hub again, just to make sure that there's no germies coming into that IV. This is a very invasive procedure, so I'll just go ahead and do that. And then I'll go ahead and we can start taping down the IV in a J shape. Perfect. Just making sure it's nice and secure, and that the window, so when I take this tape off, you can see it's secure, but you can see the IV. So you can still see the blood return and flush when we do that. Okay. Making sure the tegaderm is all nice and good. I'll go ahead and tape the hub so it's straightened out. And normally you would have your tape all ready to go, so then you're not having to bring in any more invasive germs or anything, so getting that tape ready to go is important too. Okay, so I'll go ahead and do that, and then I'll tape it just like that. So then that way you can still have access to flush, right? So the nurse coming after me can test it, and it will be easier for her to stick it in there. So I'll leave a couple inches there, just like that. I don't know if you could see that. There you go. And then I'd go ahead and throw away my sharps into the sharps container that I have over here. And then I can go ahead and sign and date my work. So I'll put my initials, which is KS. I'll put the date, which is February 20th at 1500, and I used a 20 gauge. There you go. So then the nurses coming after me know that that is a 20 gauge, and I did it at which date and how often to change it out. Yeah, we got the tourniquet off, and then I would just go ahead. Last thing I would do is just assure that they're comfortable. Does that feel weird? When I flushed it, did it feel cold or did it feel weird? No, everything felt great. Okay, then I'd go ahead and take off my gloves, throw my gloves away, and then I would go ahead and hand hygiene. That would be the last thing I do. All right, thank you.